For coming together this evening. This shows you how strong our community is. It's through events like these that we really show the support that we have for one another in this community. Substance abuse and addiction have taken center stage in communities across this nation. While the face of the drug epidemic continuously changes, it is paramount that we are both reactive and proactive in order to help save lives. Our community has been blessed to have so many partners that work together with us for this common goal. I have had the pleasure of working with 3 wonderful young ladies who have made me so proud. The Girl Scouts Heart of the Hudson have been excellent mentors in shaping these young ladies for future leaders. Lizzie, please raise your hand. Emma, Courtney. Thank you. I want to thank them all so much for their passion and determination and for the entertainment they've provided me the last few months in organizing this event. You've helped me and this community immensely. From serving on the Wappinger Central School Board of Education, I can attest to the value that CAPE brings our children for education and recovery. From being a parent who has had to deal with this crisis and being a community leader, I will assure you that Lexington Center for Recovery is listening to the needs of the community and trying to meet them while continuing to be a vital role in recovery. I have been preaching to this community for well over 2 years, and I will not stop until I take my last breath. My only goal is to save lives and help loved ones find resources and support them through their troubled times. I'm forever grateful for my partners in this mission, the Herring family, who through their own trials and tribulations have helped one of my dreams of a grassroots foundation come to life, the birth of the Matt Herring Foundation. Our name, Matt, is managing addiction through teamwork, and the phrase, love the addict, hate the addiction, was born. Among us are elected officials. I know that we have my Ward 2 councilman from the town board, Bill Ciccarelli. I don't know where you are, but I thank you for always standing alongside of me and supporting me in my endeavor. Tonight our lanterns will symbolize that there is hope for recovery and that through the worst storms there is always a beacon of light. Now I'd like to introduce a woman who is near and dear to me as a mother, a school principal, and a Dutchess County legislature representing District 13, Donna Bollner.
Thank you so much. County Executive Molinaro sends his regards. Unfortunately, he had a prior engagement, so he tapped me on the shoulder and asked me if I would attend this evening. So thank you so very much for making me a part of this very special event. And as Lori said, you know, I'm a mother and I'm a school principal, so I see this epidemic and what it's doing to our communities, not only in Dutchess County but also in Westchester where I'm employed. It is far more great than I think a lot of people may realize, and so the work that these young ladies have done, I know there's a lot of things that you ladies could have picked to do, but the fact that this is what you made a stand on and this is what you picked for your silver award is amazing. It demonstrates the conviction that you have and the understanding that you have at a very young age to be leaders and to make the steps that need to be made to educate not only the adults that are here but also the youth that is so highly affected. So I congratulate you. I am so very, again, honored to be here, and congratulations and thank you very, very much for the work that you do.
This time I'd like to introduce a woman who has her finger on the pulse. We'll just leave it at that. Elaine Trepetto, the executive director for CAPE, which is, as you know, the Center on Addiction, Prevention, and Education in our schools.
Thank you very much, Lori. It is my great privilege to be here this evening. I want to thank Lori Java for the invitation, as well as the Matt Herring Foundation. The crisis that's in front of us is a very, very serious public health crisis. The President's Commission, recently headed up by Governor Christie from New Jersey, rendered their report to the President. And as a result of that, we now know, in layman's terms, that every 3 weeks, the number of people losing their lives to addiction equals a 9/11 event. Prescription drugs led up to this epidemic. The pharmaceutical industry went out and misinformed and miseducated our healthcare community. and essentially told the medical community that the drugs that had previously been used for palliative care, long-term care of people who were in pain and facing the end of their life, this drug would not be addictive. And they saw a larger consumer market, and hence we are all here this evening facing the tragedies, both personally and economically, that have befallen our country. The United States alone consumes 85% of the global prescription drug market. 85%, folks. There is a great deal of work to be done, both in prevention, treatment, and recovery. CAPE is grateful to have the Wappinger Central School District as a partner. We provide prevention, early intervention for individuals and their families, and we have just received an OASAS grant that allows me to have 2 recovery coaches embedded in the healthcare systems in Northern Dutchess, Mid-Hudson Regional, Vassar Brothers Hospital, and Putnam Hospital Center. I would like to deliver one message to all of you. Every individual here this evening can make a difference. The fact that one of us can go out here and exponentially pass this message forward is the greatest thing we can do to change all of this, and it is happening. Over the past 5 years, you can see that people are being adversely affected and taking charge of their own lives. As the mom of an Eagle Scout and a Gold Scout Award recipients, I want to thank these young ladies, because if we are going to prevent the disease, we have to start this earlier and earlier. Again, thank you, Lori and the Matt Herring Foundation, and it is my privilege to be here speaking with you this evening.
Now, for the woman everyone calls mom, a lady who's a powerhouse and a force to be reckoned with, Sharon Herron is a mother, a grandmother, and a woman with the biggest shoulders I've ever met.
That was some introduction. Hope I can live up to it. I am here because of my grandson, Matthew Herring, who died just a day over 2 months ago, and my life has changed forever. It was changed when he started using drugs. It was a whole different life for us. We lived in fear. We had no idea we'd end up here. But the one thing that I have learned since his death is that when people think of an addict, they think hopelessness. And that's not true. We have to turn that around. We need to give our addicts hope. Hope that there is recovery, hope to the families. They have to stop being embarrassed. They have to stand up, get their neighbors to help them, get their friends and family to help them, and give everybody hope that there is going to be a recovery. And that's all I have to say. Thanks.
At this time, I'd like to introduce Linda Senior. She's a registered nurse with Lexington Center for Recovery, and she has something personal she'd like to share with you. Thank you for coming, Linda.
I lost my son November 10th of last year to an accidental overdose. I lived the life as a mom for 15 years struggling, and I know overdoses and all the nightmares that go along with living with an addict. He was well educated. He served in the 101st Airborne, and he was just an amazing young man. He worked for a while at Subaru and then at Mercedes when he was living here with me. 3 weeks before he died, I took a job working at Lexington Center as a registered nurse. He passed away 3 weeks after I started, and I was not going to stay because it was so difficult. But a few months later, I think he spoke to me in my sleep, and I'm now the director of nursing for all of our outpatient facilities in Dutchess County and for methadone. Lexington Center is an amazing place. I have been a nurse for 42 years now, and I have never met such a group of dedicated people. I'm honored to be working there and with everybody I do work with. And I just want to tell you some of the things that we offer throughout the community. We are in Dutchess, Westchester, and Rockland. We do medication-assisted therapy, which is Suboxone, methadone, and Vivitrol. We have individual counseling, we have group counseling, we do toxicology testing and reporting. We do medical assessments, follow-up, and coordination of care with your providers. We find you providers if you need one. We will help you get insurance if you have none. We have psychiatric services, we have family services, anger management, men's group, women's groups, early recovery, stop DWI, relapse prevention, home and community-based services. We work with the health department, we work with probation and parole, you name it, and we pretty much can help you out with it. And again, thank you for inviting me.
I would like to call up Matt's mom, Tricia, to keep his memory alive tonight, because this is in memory of Matthew Herring. Trish.
Matthew was a loving son, brother, grandson, nephew, cousin, and friend. He died in August at the age of 24 from his disease of addiction. All throughout his life, he played football, the sport he loved the most. He also wrestled, sailed, played baseball and lacrosse. He was a Boy Scout, a beautiful boy with hopes and dreams just like you and I. I believe Matthew started using drugs and alcohol at 15. I know his intention was just to have a good time. But by the age of 17, he was getting into trouble with the law. This was the beginning of a journey for Matthew and our family that we never thought would happen. For the next 8 years, there were car accidents, overdoses, rehabs, outpatient programs, jails, prison, and a young man struggling to overcome his substance abuse disorder. He had periods of remission where he was able to work, go to college, and create the memories with family and friends that we hold dear to us today. He spent the last 9 months of his life in state prison for a drug-related offense. There was no treatment program or counseling service offered to assist him with his disease, but he was very hopeful, positive, and talked always of the good things he was going to do when he got out. When he was released in June, he was welcomed home by a family, a loving family. There were many challenges he had to face. He was restricted by parole as to what he could and couldn't do, where he could go and where he couldn't. His driver's license was suspended, so he had to rely on family and friends for his transportation. He had tons of unpaid bills and hopes and dreams that he desperately wanted to fulfill. Unfortunately, Matthew relapsed in July. He went to rehab and completed the allotted 21 days. 9 days later, Matthew overdosed and died. We need more than prison sentences and rehab. We need a culture change. We need to shift the mindset from shame and punishment to healing and wellness. I don't want Matthew's name to die in vain. His legacy will live on through the foundation set up by the family to help spread addiction awareness. Together, we can strengthen each other and unite as a community to put an end to the stigma. And now, these three remain: faith, hope, and love. But the greatest of these is love. Matthew is loved, and love never dies. Love never ends. Matthew's legacy will live on forever. Thank you.
Before we release their lanterns, realize that if you have a story, I urge you to tell your story. No life is lost without meaning. No one is struggling this struggle alone. This war does not discriminate. Please take off your masks and tell your story. Everyone needs to hear a story so they know that they can have support out there.
Gina Paleshi, Thomas Byington, Dave Lovey, Jonathan Kinstry, Jessica Renee Guillory, Diane Madfrey, Chrissy Alaverda, Amy Mayers, Gabriella Santiago, Margaret Lynch, Terry Caputo, Christopher Caputo, Michael and Savannah Curtin, Trish Miller, Will Dayton, Ryan Mayers, Vanessa Ratigliana, Stacy Hadley, Zane Logan, Reese Logan,
Matthew Herring,
Sean Kelly, Alan, Michael Whalen, Glenn Rippo, Kevin Brown, David McKnight, Jimmy, Alex Polishi, Obi Rick, Diane Hardy, Keith Jennings, Joe, Nick, Andy, Paul, Donnie, Jeremy, Luke, Shane, Rick, Rachel, Ciro, Gelly Ganano, Ryan Sheehan,
Adam Christopher Vitti, Kevin Farmer, Maddie Guerrero, Ronald Shepley, Vincent Lynch, Lewis Michael Tucker, William Early.
Andy DeMayo.